Screening for transfusion transmissible infections. Screening for transfusion transmissible infections is critical in blood transfusion services to ensure patient safety. What are the infections that are mandatorily screened for on all blood units in India? In India, every blood unit collected from the donors has to be screened mandatorily for HIV 1 and 2, hepatitis B virus, hepatitis C virus, malaria and syphilis. This video describes the ELISA and rapid testing methods for HIV, HBV and HCV screening, smear tests for malaria screening, RPR test for syphilis screening, HIV, HBV and HCV screening. HIV, HBV and HCV are routinely screened by ELISA tests which detect anti-HIV antibodies, HBV surface antigen and anti-HCV antibodies. ELISA procedure. First, let us list out and describe the equipment, reagents and basic requisites required to perform the ELISA procedure. Equipment: ELISA washer, ELISA reader with printer, incubator, calibrated micropipettes 1 to 10 microliters, 5 to 40 microliters, 40 to 200 microliters, 200 to 1000 microliters, tabletop centrifuge. Consumables: kits for testing anti-HIV antibodies, HBV surface antigens and anti-HCV antibodies. Micropipette tips 20 to 200 microliters, 100 to 1000 microliters. Gloves, test tubes, test tube racks, 1% sodium hypochlorite solution, distilled water, tissue paper, marker pen. It is important that biosafety precautions be taken before the test is performed. We now proceed to see how the ELISA test is performed. Preliminary measures. Sample identification is done by cross-verifying donated blood unit numbers with corresponding pilot tubes containing serum. Check the reagent kits for lot numbers, expiry date and any visible abnormal changes. Prepare worksheet with particulars such as name of the test, date of testing, reagent lot number and expiry date, name of the technician performing the test, signature of officer in charge, and unfilled columns for entering positive and negative controls, and donor unit numbers in sequence. Always adhere to manufacturer's instructions. Test kits, reagents and samples are brought to room temperature. The donor samples are centrifuged to separate the serum, 3000 rpm for 3 minutes. Test procedure. Prepare wash and buffer solutions according to the manufacturer's instructions. With the help of a micropipette, load the respective wells with the required volume of controls and serum samples with diluent. How do you hold the micropipette during sample loading? A. Horizontal with tips touching the side. B. Vertical with tips not touching the side. Yes, the answer is B, vertical with tips not touching the sides. Hold the micropipette vertically and dispense the samples into the wells. Do not touch the sides of the well to avoid cross-contamination. Make sure that tips are changed after dispensing each and every sample. Discard the tips in a kidney tray containing 1% sodium hypochlorite solution. Then incubate the microplate at temperature and duration as instructed. Now wash the microplate using ELISA washer as per kit literature. Invert the plate over a tissue paper and dry it by gently tapping. Then add enzyme conjugate and incubate again. Repeat the washing step. Meanwhile, prepare the enzyme substrate and keep it ready. Dry the microplate and add enzyme substrate to the wells as per instructions. Add stop solution to fix the color developed in the wells. Ensure that the blank well is negative. If not, the test is invalid. Results must be read immediately using the ELISA reader. A printout showing the absorbance values for the samples in the microplate is obtained. Interpretation of results. Calculate the cutoff value as per the kit literature. Those which are above the cutoff value are interpreted as positive or reactive. What is the gray zone in the interpretation of OD values in the ELISA test? A. 10 to 20% above cutoff. B. 0 to 10% above cutoff. C. 0 to 10% below cutoff. D. 10 to 20% below cutoff. Yes, the correct answer is C. 0 to 10% below cutoff. Values ranging from 10% below the cutoff absorbance to that of the cutoff value fall under the gray zone. Values below the gray zone are interpreted as negative. Samples in the gray zone have to be retested, and if the cutoff value falls within the gray zone again, or if it is more than the cutoff value, then it is considered positive. Document the results. The printed report of absorbance values and the worksheet should be maintained in separate registers. How do you discard the biomedical waste generated? After the test is over, discard the tips and microplate in the red biohazard container. All the infected surfaces are cleaned with 1% sodium hypochlorite solution. If there are blood spills, clean them with 1% sodium hypochlorite solution. Unusual outcome of the ELISA test should prompt you to reassess the entire procedure step by step and make the necessary corrections. For example, if there is a high background color, check for accidental reuse of disposable tips, contamination in the reagents or wash buffer, improper washing or inappropriate incubation. Similarly, if there is no color development, check for the following. Have any steps been missed out or skipped, such as addition of sample conjugate, substrate incubation, or addition of reagents in the wrong sequence? An outdated microplate or reagent, or using a contaminated stopping solution. Likewise, if there are bad results in one column or row, check for clogging of wash channel in the washer, well-to-well contamination, improper washing. Always remember, even this third generation ELISA testing cannot detect the antibodies during the window period. Rapid diagnostic tests. When ELISA testing is not feasible during emergency situations, rapid diagnostic tests based on immunochromatography is done. In this procedure, when bands form in the control and test regions, it is considered positive. When a band forms only in the control region but not in the test region, it is considered negative. When no bands form in the control and test regions, then the test is invalid. This concludes the screening methods for HIV, hepatitis B and hepatitis C viruses. Malaria screening. The materials required for malaria screening are microscope, glass slides, Leishman's stain, Sorensen's phosphate buffer with pH of 6.8, cedar wood oil, Now let us move on to the screening procedure for malaria. It is done by the microscopic examination of thick and thin blood smears. Prepare at least 2 thick smears and 2 thin smears from the EDTA sample within 2 hours of collection. Stain only 1 set of smears and leave the duplicates fixed in methanol for restaining when in doubt. How do you prepare a thick smear? Place a drop of blood on the specimen slide. With the corner of a clean slide, make circular motions in the drop to a diameter of 1 to 2 centimeters. How do you prepare a thin film? Place a drop of blood on the specimen slide. Keep a clean spreader slide at a 45-degree angle towards the drop of blood and wait till the blood spreads along the entire width of the spreader slide. Now, push it forward rapidly and smoothly. Keep it aside for air drying. How do you know that the prepared thick smear is adequate? A. You cannot look through the smear on the slide. B. You can read newsprint through the smear on the slide. Yes, the correct answer is B. You can read newsprint through the smear on the slide. You should be able to read newsprint through the thick smear on the slide. Air dry these smears for 30 minutes to 1 hour at room temperature. Now, both the smears are ready for staining. How do you stain the thin smear? The thin smear is stained by flooding the smear with Leishman's stain and leaving it for 2 minutes to fix. Now, add twice the amount of phosphate buffer. Leave to stain for 15 minutes. Wash off the stain with tap water. Dry the slide upright. The slide is now ready. How do you stain the thick smear? Thick smear is also stained similar to the thin smear. It is then kept in distilled water for 10 minutes and then dried. The primary staining procedure is once again repeated. Now the slide is ready for reading. How do you use thick and thin smears for Plasmodium detection? A. Thick smear for species identification. B. Thin smear for parasite detection. C. Thick smear for parasite detection and thin smear for species identification. Yes, the correct answer is C. Thick smear for parasite detection and thin smear for species identification. Thick smears are used for detection of malarial parasites and thin smears for identification of species. Ideally, thick smears are examined for a minimum of 200 oil immersion fields by using 100x objective. If there is evidence of malarial parasite in the thick smear, identify the species by examining the thin smear. Now, let us see some pictures of malarial parasites in the peripheral blood smear. Malarial parasite screening can also be done by rapid antigen detection, immunochromatography tests. How long can malarial parasites remain viable in stored blood components? A. 18 days. B. 3 days. C. 1 day. Yes, the correct answer is A. 18 days. Since asymptomatic carriers are known in endemic areas, and malarial parasites can survive for at least 18 days in plasma and whole blood, screening for malaria is absolutely essential. Syphilis screening. We now move on to discuss the screening method for syphilis by rapid plasma reagent test. The materials required for this test are RPR cards, carbon-coated antigen, positive and negative control, small sticks, dropper, VDRL rotator. This test detects the anti-lipoidal antibodies which form black floccules when carbon-coated antigen is added. The procedure is as follows. First, bring the kit and reagents to room temperature. Mix the carbon-coated antigen suspension by gently agitating before testing. Place 50 microliters of patient's serum, positive and negative control, in the circles using sample dispensing pipette. Add 1 drop of carbon-coated antigen to the serum sample using antigen delivery dropper. Take care not to touch the liquid with the dropper tip. Mix using the stick. Then, rotate the card at 180 rpm for 8 minutes in the VDRL rotator. Examine the card for floccule formation to interpret the results. How do you interpret RPR test results as reactive? A. Black floccules against white background. B. No floccules in an even grey background. Yes, the correct answer is A. Black floccules against white background. If large or medium black floccules are seen against a white background, it is interpreted as reactive. If there are no floccules in an even grey background, it is interpreted as non-reactive. How long are the spirochetes viable in stored blood components? A. 18 days. B. 7 days. C. 3 days. Yes, the correct answer is C. 3 days. Since spirochetes can be viable up to 72 hours in citrated blood at 4 degrees centigrade, there is a risk of transmission of syphilis. This age-old RPR method is simple and holds good even in modern transfusion practice. Screening procedure for transfusion-transmissible infections is very crucial. Hence, lab personnel should ensure quality throughout the entire screening procedure.